triple the number of operators, an updated phone system, and more work on the website. Will it all be enough to make sure laid off and furloughed Kansans get their unemployment? Plus, the fight over what limits the state can put on churches in a public health emergency. And where does Kansas stand as we enter what may be the hardest weeks of the fight against the coronavirus? That's what we're talking about right now on Kansas Week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
I'm Pilar Pedraza, and this is Kansas Week. We've been talking about the coronavirus in Kansas for a month now, and state health leaders say the worst should be here in the next couple of weeks. But things aren't looking as bad as they could. As of recording time on Friday, the state had 1,166 confirmed cases of COVID-19. That after the state saw its largest jump in both new cases and deaths to date this last Wednesday. 50 Kansans diagnosed with COVID-19 have now died, while 10,248 have tested negative for the virus. The state isn't reporting recovery numbers at this time, but some counties are. Those numbers today add up to Kansans about 89 or so recovered from the virus. With healthcare workers not predicting infections will peak in Kansas for another week or two, the governor indicated she expects they'll extend the current stay-at-home order.
We are having conversations about that, about whether or not we'll extend the stay that I think now is in effect until April 19th. We will be addressing that issue with everyone early next week. My guess is yes, we will extend it, but we don't have the details on that right now.
And joining me this week to explore what this all means for us are Wichita Mayor Brandon Whipple and Sedgwick County Commissioner Vice Chair of the Commission, Lacey Cruse. Thank you so much.
Thank you.
And
thanks for having us.
As we look at this situation, it's changing by the day, the county and the city doing what they can to prepare. Where do we stand right now in what hospitals say we need and what we have?
So, really, the county is really in the driver's seat on this. So, and at the city, we're more of a partner role. So I'll let Lacey kick it off, and then I can also, or excuse me, Commissioner Cruse, and then we can.
We're so informal.
I know we knew each other before I was elected mayor. She was elected commission, so I'm trying to be formal. But please go ahead and take it away.
So our hospital systems, we meet with them weekly to get an update, and what they need right now is for people to stay home. At Sedgwick County, we are trying to test as many people as we can, but we are under strict guidelines from KDHE. The thing that we want to try to do is get as many people tested as possible, obviously following those guidelines. So we're trying to follow the Johnson County model. They're going to try to set up 3,000 to 5,000 tests. But just to show you the current situation right now, we only have about 550 test kits. So we can't open up a random test just to anybody quite yet. But that's the plan, because once we know who has the virus in our community, we can get back to normal, I guess, right? I guess we're going to be under a new normal soon, but that's the plan, is to really stay the course, stay home, and make sure that we mitigate the peak that's coming.
And you talked about the 500 test kits. Is that why is it that Sedgwick County only has that many? Is that because they can only get that many from the state? Is there a financial aspect they couldn't get them from private labs?
It's supply, really. We received about 300 from the state this week, another 75 from Quest. So we're doing all that we can to try to acquire some. And in fact, our folks at the county, we contacted 420 vendors. We made over 900 contacts to see what kind of supplies that we could get, whether it's the nasal swab or the transport devices, and we're doing the best we can to get what is out there that they'll send to us.
And one of the things I'll just touch on is we want the county to get the tests that they need, and it's supply and demand. We are in a better position here in Wichita at this moment than other communities are that are other large cities are. So it's reasonable to believe that some of those tests are going to some of those large cities as they try to contain this crisis. through the training that I've had this past month, being on webinars and online classes with Johns Hopkins University and the Harvard program, one of the questions that came up is, well, what's the model city? Like, who really internationally knocked this out of the park? And one of them that came up was Singapore, was a city that didn't have the testing, but the people understood the significance of social distancing and staying home. And sadly, it was because some of these Asian cities survived the bird flu, survived some of these other type of pandemics, and they learned a lesson from the past where if you don't take this seriously, people will get sick and people will die. So what we want to do here in Wichita, and I think one of the reasons why we're doing better than some other comparable cities is, I think it was 4 weeks ago, we started asking people for a voluntary stay-in, and at the county level, they created the stay-in policy, and then the governor created her stay-in policy. And we've been at this for a while because we want to learn from the mistakes that other communities have made without having to learn from our own mistakes. So it's really, the testing is super important, and once we get that, that's going to be something that's going to help us battle this. But staying in and just practicing the social distancing is really what has led us to having the success that we have had.
And talking about staying in, there's been a lot of talk lately about whether or not to go to church. Obviously, this is Easter weekend. A lot of people are very concerned about that. While every Kansas leader I've spoken with agrees we should be staying home as much as possible and avoiding crowds of any sort, there's a lot of disagreement over whether the state can order churches to limit activity to 10 people or less, leading to the governor suing state legislative leadership. According to our partners at the Wichita Eagle, this last week, Governor Laura Kelly issued an executive order limiting church gatherings to 10 people or less. She cited 3 cases where larger church gatherings in Kansas had led to the spread of the coronavirus, creating new clusters of the disease. But the next day, the Legislative Coordinating Council, made up of 5 Republican and 2 Democratic legislative leaders, overturned that order on a 5-2 vote. Republicans cited concerns about violating the state constitution's religious freedom protections after warnings from the Kansas Attorney General. Thursday afternoon, Kelly sued the council.
After consulting with my chief counsel, this afternoon I have instructed him to file suit against the Legislative Coordinating Council in order to ensure that politics does not continue to hinder our ability to save Kansas lives.
The governor believes the state's emergency management law requires the full legislature, not a 7-person council, to review her executive orders. Senate President Susan Wagle accused the governor of being the one playing politics when she released this written statement saying it is not good policy to endorse an order the Attorney General warns infringes on our constitutional rights and has told law enforcement they cannot enforce. The House Speaker suggested we allow the executive order to take effect if she agreed to not arrest and prosecute persons attending a worship service. Governor Kelly refused. While the future of that order is now in the hands of the Kansas Supreme Court, Sedgwick County says its order limiting the size of religious gatherings remains in place.
I don't think there's a Democrat virus and a Republican virus, but it kind of gets that way a little bit federally and obviously at the state level. And we're just trying to do what's reasonable.
Sedgwick County Commissioner Pete Meissner Thursday re-emphasized for the public, no matter what's happening in Topeka, the Sedgwick County ban on church gatherings of more than 10 people remains in effect.
We've got to get through April, and now is going to be the critical time where you're going to see stuff happening.
Meissner said the commission has worked with community leaders from the beginning to come up with a plan that works best for Sedgwick County, and that includes local faith leaders. Certainly something that has raised a lot of eyebrows as this has been going on. We now know that the Supreme Court is supposed to hear this case on Saturday, so we don't know at the time of recording exactly what all of this will end up being. But what we do know is that churches are saying, for the most part, they should stay home. But there are some that have not been following that rule. On Friday, Secretary of Health Lee Norman said that they have now a 4th cluster in Sedgwick County that came from a religious gathering that happened after the order went into place for churches. There's a reason why they're asking us to stay apart. And you guys have been talking about this for weeks now.
Oh, yeah.
I mean, it doesn't matter where you're at or what you're doing. If you're around other people, you could spread the virus. People are spreading it unknowingly. Who wants that on their hands, that they were carrying this virus and giving it to someone else? At Sedgwick County, absolutely 100% respects the First Amendment. We're not telling people they can't worship. We're telling people they can't gather. So worship via Facebook, worship via YouTube, worship via whatever mechanism you can electronically or in your own homes. But this is for the safety of residents. This is not restricting any religious freedom whatsoever. It's restricting a gathering, any gathering, so that we can mitigate this spread. Because when you're with somebody, you're going to spread germs to each other. It's just, it's science.
And this is one of the issues with this type of policy, I think, is it's very easy for us to look at the technicalities of it, right? To like almost get into academia with it, where what is an essential business versus non-essential? What is, where's the gray area on violation of personal freedoms and rights versus the rights of our neighbors by allowing them to also stay safe and healthy. We should be talking about this as not really a stay in order, but a stay safe order, a stay smart order, right? Where common sense is, right now we have a virus that could kill a big part of our population. And for us to get over this and give our first responders really a chance at not being overrun, we have to do our part by not being in a situation where we're spreading droplets, where, you know, when we talk, where droplets can come off onto someone else and wind up like some of these other big cities. And I'm a person of faith. My wife works for our church. It was really a blow to us when our bishop canceled Holy Week. And the reality is, you know, we're going to have to adapt because we want to keep our neighbors safe.
And I know part of that adaptation, several churches have started using the hashtag ICT together.
Yeah, very proud of that, actually. Because it's showing a community coming together. In Wichita, we have some of the best people in the world. And it shows particularly where we might be separated physically and apart, but we're too good of a community to let that stop us interacting. And on Sundays, we're seeing it's ICT together on Facebook and on Twitter, where we're seeing people who are still having church, but it's empty. They're recording it and they're putting it online or doing it live. If you go to that hashtag, which is #ICT together, you will see all of these churches throughout Wichita in these religious services, and you can, you know, all of us join together online right there to watch and be a part of, you know, this community coming together for worship.
So those that are part of a smaller congregation that might not have the technology that their own church is putting on, they could enjoy another church. Mm-hmm. You know, I think that's an amazing thing and a way to bring our community together that wouldn't have happened before.
No. Well, and bringing folks together at this time when we're all supposed to be staying separate is kind of really important. A lot of folks really struggling with the mental health aspect of this as their lives have changed drastically. This is happening across the country as Americans are being told to stay home. We are hearing reports of increases in mental health problems like anxiety and depression. Kate's Lacey Williams takes a look at how to keep a healthy mind as well as body in these stressful times.
Between businesses shutting down, the number of COVID-19 cases rising, and rapidly changing information, the pandemic is taking a toll on mental health. Local business owner Ashlyn Friel says the past several weeks have been difficult to navigate.
Yes, the last couple of weeks have been really difficult.
She and her husband Eric own a videography and photography business. The couple, usually busy capturing special moments, now stuck at home.
So that in itself kind of added a lot of stress. You know, bills, all that stuff with no income coming in, and that's just pulling out of our savings.
Friel and her husband also navigating another adventure. The couple welcomed a new baby boy just 10 weeks ago before COVID-19 set in. Eric Litweiler with the Mental Health Association of South Central Kansas says with all of the changes to everyday life, it can be easy to feel overwhelmed.
It's hard for us to get our bearings, and that certainly creates, I think, the other major part of mental health concerns is just people not knowing what to expect, not knowing what to do next.
He says there are practical steps people can take to cope with the fear and anxiety of the pandemic, like creating structure by sticking to a schedule, reaching out if you need help, and staying connected to support systems.
But still utilizing phones and video conferencing and text messages and email.
Mental health experts say while it's important to stick to a schedule, it's also important to try new things.
Like that new recipe you've been wanting to try. Attempting a new workout to stay healthy. Learning a new hobby or activity.
Friel says she's taking extra time for her little ones and for herself while focusing on the positives in a time of uncertainty. Lacey Williams, Cake News on your side.
And one of the things that a lot of people are doing in response to this is trying to help others to kind of stay sane themselves. And I know that there is still a lot of need for a lot of personal protective equipment here in Sedgwick County as well as many others.
Yeah, I think it's really been incredible to see all the partners that have come together through the Air Capital Commitment Task Force, the Greater Wichita Partnership, our Regional Chamber of Commerce. I mean, we're looking to help local businesses that have this stuff or that could help us acquire it. So face shields, hand sanitizer, isolation gowns. You know, I heard a story of Vanya Designs working with Wichita Create to make face shields or masks. You know, it's not real cool. I guess, you know, we have to wear these things that aren't very comfortable, but they really could save lives. So I'm very excited about the partnerships that are happening. And if you guys have the ability to donate those things, please let us know.
Yeah. And in donating items, certainly one way. Another thing that a lot of people are really stressing about, though, is loss of jobs. Unemployment is at one of its highest rates ever. And we're really working hard as a state to help move forward. And one of the things that they're dealing with between layoffs and furloughs is a record number of Kansas unemployed and continuing to overwhelm the antiquated systems at the Department of Labor. Earlier today, I spoke with Delia Garcia, Kansas Secretary of Labor, and Laurel Klein-Searles, Kansas Department of Labor Unemployment Insurance Director, about their efforts to fix the problems and the kinds of aid available from both the state and federal governments.
We went live yesterday with the triage call center that was able to answer, 4,332 more Kansans compared to on a Monday previous for 1,336. So that's a big win.
In addition to adding on the Triage Contact Center, which is a partnership between the Department of Labor, the Governor's Office, the Department of Agriculture, and the Department of Commerce, I've also increased my staff taking the phones and then also brought back retired staff to be able to do other jobs that are necessary to keep these unemployment insurance claims processing.
As we're looking at the expansion, a lot of it has been talking about the phone call center. But a lot of folks, you've been asking folks if you can at all sign up online.
Yes.
But a lot of the folks that we've spoken with said we tried online and we kept getting kicked off the system.
So one of the things that we have identified is that, there are times when you are filing your weekly claim on the web and it will pop up with a message that you need to call the contact center to get this issue resolved. We're looking at other methods to get those issues resolved, setting up some email boxes or web forms so that instead of going through the telephones to get those more complicated issues resolved, we can find another means of communication. So I'm hoping to be able to roll some of those out next week. Hopefully be between the Triage Contact Center, getting some of these enhancements and working through some of these technological issues, and then providing alternative means of communication for folks, we'll be able to serve more Kansans.
In the last 3 weeks, we've been experiencing all these challenges with our technology. And some of the things we've been seeing is, we have this older mainframe, and when it gets high traffic that it's not used to. And what we're seeing is when there's a lot of traffic at like the same time and hour, like she was saying, everybody was, I think, thinking that, I have to file my claim at noon, that's it, on Sunday. When we've been trying to share, actually, no, you have all day Sunday, you have all day Monday, you will still get your money at the same time if you did that. Also, very important, you can actually file all week long and you will still get your money. So, sharing those important pieces of information of the best time to do this might be through the window between 6 in the morning and 8 in the morning, or after 4:30 up until 10 p.m. because we do daily maintenance from 10:15 in the evening until 6 in the morning where we do updates to our technology system.
We did the story last week and then again this week about the issues and specifically mentioned COBOL. I have had folks who did programming and engineering with COBOL coming out of the woodwork offering to volunteer for help. Do you guys actually need that help, or is it just a case of it takes it's time to do it?
So the issue that we have is, yes, there are people coming out of the woodwork who are able to do the COBOL programming. However, our system, the code within our system is so old that and so complicated that it would take those folks a very long time to get familiar with it, because there's code upon code upon code for the last however many years worth of legal changes that have come in and out of the system, that our IT division at this point is saying, if we brought these people on, I don't know how long it would take to train them to understand our particular system. And right now we're short on time, so we're trying to make the most. We have brought back some retired employees and people that formerly used to work with us in our IT division as well, who are more familiar with that and can respond to the crisis we're currently facing.
Federal benefits coming online. You guys held a town hall this week kind of describing what some of those changes are. What are the biggest changes and what does the public need to know the most?
The public's probably most interested in the additional $600 per week that will be coming out to them soon. That is something that has to be programmed through our mainframe that our team is working on right now. So we're hoping to have the additional $600 in benefits available to claimants in the very near future. We don't have a definitive timeline at this point, but we are actively working on that to make sure that we can get those paid out. Also, if we will give you the additional $600 for the weeks that you are eligible when we do have this program up and running. And then the other program that people are very excited about is the Pandemic Unemployment Assistance Program, which provides an unemployment insurance benefit for those who are traditionally not eligible for unemployment insurance. So to be monetarily entitled to unemployment, you have to have wages in your base period, covered wages within your base period. That means you work for an employer in a position in which they pay unemployment insurance taxes on that position. Those who are self-employed or a gig worker are traditionally not eligible for unemployment insurance benefits. This program, which we refer to as PUA, P-U-A, will provide a benefit for those people. This is a completely brand new program. We are working on it and getting it established, but it's going to take some time. So I just want to set realistic expectations for people that Congress just created this program. All of the states are working right now to interpret their guidance, which just came out on Sunday and continues to come out almost on a daily basis as we work to implement this program, while at the same time, we're trying to serve, we had 27,000 initial claims the first week. We had 55,000 the next week. We had 50,000 this week. So we're serving volumes of people that we've never seen before, while at the same time creating a brand new program. It's a lot of pressure and stress on this aging technological system. So we are looking very carefully on how we build this, that it's sustainable and we get benefits out to people as soon as possible, because we know that they need them now.
There's a lot of talk, though, that other states have already started handing out that $600 to folks. Is that just talk?
We have almost daily calls with other states. Right. And Secretary Garcia, have you heard any state say that they are actively paying it out right now?
No, not one state. We have heard, we have plans to do this, but we all are having the same technical issues with our systems. So I haven't heard of one state that has started actually doing it. And I also wanted to add on the $600. We have been receiving a lot of phone calls on the $600. And the additional question is, what do I need to do to get the $600? If you're already receiving the benefit, you don't have to do anything. You're already in the system, and that will automatically come.
Now, there had been a comment before about the first week waiting period being lifted, but there was a glitch in the system, and the promise had been that we will be paying people back for that first week if we missed it.
Yes.
Is that the same thing with the $600? When you talked about everybody will get it, if they've had unemployment for 1, 2, 3, 4 weeks before that starts going through the system, will they get the back pay for that time?
Only starting from March 29th.
So they will only get it for the amount of time that the program was active and that they would be eligible for it. But yes, they would get all the weeks that they were eligible for. It just may be that we get it to them later. And frankly, I would hope to get it to them sooner. But as I said before, I'm not going to make promises that I cannot keep.
What is the biggest question that you're getting from callers right now as they're trying to work their way through the system?
The questions really vary day to day. We were having some issues with password PIN username resets that I believe we spoke with you before about. We have implemented new technology on our website to help alleviate some of those issues. I do hope that it is working for people. And so hopefully we'll start seeing those calls dwindle.
We've got a lot of folks that have been furloughed from major manufacturers here in the Wichita area, Spirit, Textron, et cetera. Many of them have contacted me telling me that they're still working because they're considered essential employees, but they've been told to keep filing for unemployment insurance as well, even though they're working, to keep the claim alive. And yet the claim comes back as denied because obviously they're working.
Right. So you can work part-time and receive an unemployment insurance benefit. So I don't know if these people are working full-time or not.
Working full-time.
You can, if you keep filing on a weekly basis, that does keep your claim alive, because if you do not file for too long, then your claim goes inactive and you will have to reopen it when you go off of work. So those situations really vary case by case. We have some employers on the shared work program. We have some employers that are working their workers just part-time. We have some people who are working full-time but planning to lay them off next week. And so there are so many different variables. So I think it's important to remember that we have a variety of resources on our website. We have the frequently asked questions section that has a full benefits guide that will walk you through the entire unemployment insurance process. We have video tutorials on our webpage that can help you with some common processes, because we really are here to serve the Kansans, and we're doing our best to do that right now in these difficult times.
And we did have to edit a few portions of that interview out because of some technology issues. We did edit them only for clarity, not for content. Again, that website that they're talking about is getkansasbenefits.gov. We want to extend a special thank you to Brandon, Lacey, Delia, and Laurel for taking time out to speak with us today. I hope we've managed to answer some of your questions about the pandemic and its effect on your life. We'd love to hear from you. Just email us at kansasweek@kpts.org. For now, stay home, stay safe, and try to have a great week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.